Hi, this is Matt Plummer. Welcome to the California Quest. In today's debate, we are covering the topic of should California legalize supervised drug injection sites. The California Quest is an effort to tackle California's biggest challenges and change the conversation about potential solutions so that we're looking at both sides of the argument for and against them and assessing the arguments critically and having an open, nonpartisan conversation about them. So let's jump into a little bit of history and context on supervised injection sites before talking about the case for them and the case against. Okay, so supervised injection sites are go by a few different names. They are also known as safe drug consumption sites, and they are basically facilities where people can use illegal drugs under the supervision of trained staffs, whose main goal is to prevent overdose deaths by injecting them or giving them access to Narcan if they experience an overdose happening. So that is the main goal of these sites. They also often provide additional health and social services, or at least are a connection point or referral point into those services. Right now, it is illegal for a city in California to open up a supervised injection site. It's also technically illegal at the federal level for this to happen. However, the San Francisco opened what they called the Linkage Center, and that was a downtown center that was intended to connect people to a variety of different social services. And reporters exposed that a part of the Linkage Center was actually being used essentially as a safe injection site. And so that kind of caused a bunch of controversy. There was a lot of back and forth on it. Ultimately, the city ended up shutting down the Linkage Center completely in December of this past year. Now, there were a number of reasons why it shut it down, but one of those had to do with the controversy surrounding the safe injection sites. Senate Bill 57, which went to Governor Newsom's desk in August, would have legalized the trial of safe injection sites in 3 cities. So Oakland, San Francisco, and LA, they would have been able to trial these sites through January 1st, 2028. However, Governor Newsom vetoed that bill in August, saying that he was not going to authorize these experiments. Here's what he literally said. I have long supported the cutting edge of harm reduction strategies. However, I am acutely concerned about the operation of safe injection sites without strong, engaged local leadership and well-documented, vetted, and thoughtful operational and sustainability plans. The unlimited number of safe injection sites that this bill would authorize, facilities which could exist well into the later part of this decade, could induce a world of unintended consequences. Newsom rejected it, and California is really in this early stage of figuring out, is this something we want to do as a state? Cities are in different places, but the history of these sites actually goes way back to the beginning of this millennium. So the sites opened in Vancouver, Canada. We'll talk a lot about that site. And there's also sites in Europe and Australia. And in fact, New York City just opened 2 safe injection sites in November of 2021. Philadelphia, Boston, and Seattle are all considering these somewhere on the path to pursuing this happening. So why is this important? Why is this coming to the forefront now? Well, it really has to do with the opioid crisis, which has claimed thousands of lives due to overdose deaths. And so overdose deaths in California have increased roughly 3 times in just the last 5 years. And so this is really significant, and these sites are seen as a way to basically prevent some of those deaths. San Francisco, for its part, though it closed the Linkage Center, actually just the Board of Supervisors passed a motion that would change permitting laws that would make it easier for a facility of this type to be created in the future. So that's a little bit of the backstory on safe injection sites. The debate for today is, should California legalize supervised injection sites? For the case for legalizing these sites, number 1, safe injection sites save lives by preventing overdose deaths. Number 2, supervised injection sites increase access to addiction treatment. Number 3, normalizing drug use reduces stigma, increasing usage of supportive services. Okay, now let's look at the case against legalizing these sites. Number 1, supervised injection sites increase drug usage and worsen addiction. Number 2, supervised injection sites make the surrounding community drug-infested and crime-ridden. And number 3, supervised injection sites violate federal law. Okay, let's look at the case for first, jumping in with supervised injection sites save lives by preventing overdose deaths. And as I mentioned, this is really the goal of these sites. Senator Scott Wiener, who proposed and authored SB 57 that would have legalized these sites, explains this goal. He says, "We know that we are experiencing a crisis of overdose deaths, and these are preventable. This is one way to help keep people safe and to actually help people get into treatment." Another one of our legislature's Democratic Assemblyman, Miguel Santiago, also says it is an attempt to create a safe place for people to use drugs to help them when they are at their lowest and to prevent the worst from happening. A 2014 review of 75 studies suggested that these sites do reduce overdose deaths. And in fact, there was a long-term study of the Insight Center, which is based in Vancouver, and that's kind of the first supervised drug injection site. And that study went from 2003 to 2016. And during that time period, reportedly, there were no overdose deaths in the facility. They also report that overdose deaths in the surrounding area around the center, so in the broader geographic area in Vancouver, fell by 35% during those 2 years versus just a 9% reduction across the city. And so not only did overdose deaths go to zero in the facility, but also in the surrounding area, they went down. The New England Journal of Medicine also found similar results when they were evaluating an unsanctioned supervised injection site that went on the U.S. In fact, they don't even mention where it was, so we don't know where it was. But this evaluation came out in 2014, and there were over 10,000 injections and 33 overdoses during those 5 years, but no deaths. So again, this idea that it's preventing deaths seems to play out here. One analysis in San Francisco found that for every dollar that you would invest in opening these sites and operating them, that it would save $2.33 in emergency, medical, and law enforcement costs. However, there are some disputes around some of this claims, particularly around the Vancouver facility. And so I mentioned that overdose deaths around the area fell by 35% versus 9% more broadly. Well, some say that this contains serious errors, and the claim that all overdose deaths in Vancouver declined between 2001 and 2005 is strongly affected by the highly questionable inclusion of the year 2001, a year of much higher heroin availability and overdose fatalities than all subsequent years. So basically suggesting that they included this outlier, which made it look like it went down when the trend line really didn't. So, that doesn't dispute the fact that no overdose deaths happen in the facility, but in the surrounding area. Rand Corporation also performed a systematic analysis of the studies that have been performed on this topic. And what they say is the scientific evidence about the effectiveness of these facilities is limited in quality and the number of locations evaluated. And that is a central theme that I will bring up a few different times, which is that, I'll mention, this study reviewed 75 different studies. It was a meta-analysis, which tends to be more robust in the sense that it's not just one study, but it's looking at multiple studies. The problem is that most of these studies are looking at one or a few safe injection sites, and so they're all evaluating the same ones. So, it's possible that that particular site is effective, but that doesn't mean that it's representative of everything that's being done. So that's something for us to keep in mind as we're looking at the data on this. Keith Humphreys, who's an addiction researcher and a psychiatry professor at Stanford University, says, "Nobody should be looking at this literature making confident conclusions in either direction." So again, kind of that there's some concerns about the data here and, whether or not some of this can be really representative of what would happen more broadly. For example, authorities in another Canadian town, Alberta, reported vastly different results. They said public health authorities released a bombshell report that showed sites did not reduce overall overdose deaths or opioid-related emergency calls. Now, again, I don't think that anyone's really disputing whether the number of overdose deaths in the facility gone down or even went to zero, but that in the surrounding area, that's where there's a lot of this debate. And so people come out on different sides of it, and that's something for you to weigh. So Dr. Sharon Larson, who's a professor at Thomas Jefferson University, she also has concerns with it, but she says it does not give me pause about developing these injection sites, and basically says we just need to continue to study this and we'll see what happens. So yes, within the facility definitely reduces overdose deaths, but in the surrounding area, there's mixed data there. Okay, let's look at number 2 in the case for legalizing these sites. That supervised injection sites have can increase access to addiction treatment. And so, if we look at that first argument, which is that they reduce overdose deaths, I would imagine that even critics of these sites would grant that to supporters. I mean, if you have trained staff whose job is to do that, then that would make sense that that's happening. But the critics again argue that, okay, you're doing that, but at the cost of increasing addiction and drug use. But if these facilities can get more people into treatment centers, then that could, flip those critics. And so we see, again, New England Journal of Medicine study, they said that several studies suggest that these sites improve the health of people who use the sites by facilitating access to general health and social services. Again, that 2014 review of 75 studies reached the same conclusion. Now, that's generalized access to health services, not necessarily addiction treatment. However, other studies have found increased uptake of detoxification services, addiction treatment, and significant improvements in that. So there is that, one study in particular found that 18% of those in the study began a detoxification program during follow-up. So this is certainly happening at some level. Now, how broad is that? And what counts as a significant increase in referrals? So let's look at the San Francisco Linkage Center, for example, which is the one that was then shut down after it was exposed. And just for context, was also known as the Tenderloin Center. As of June of last year, it says that the Tenderloin Center doesn't have great numbers on getting people into addiction treatment. 53 people have been referred to substance abuse treatment so far, and there's no information on the outcomes. So 53 people, is that a lot? Is that a little? Well, what we know is that from January to May of last year, the city reported that 50,000 people had utilized the center. So 50,000 had used it between January and May. This was reported in June, and 53 had gone into treatment center. So if that is accurate, then that is, very, very few people. That's 0.1%. So there's other data that suggests that this around 1% referral rate, I just said 0.1, but even 1% is something that is maybe perhaps more common. So in Alberta, when they were having public meetings around the use of these sites, they said that sites have a poor record of moving drug users into treatment and recovery, with some referral rates as low as 1%. So again, we see some mixed data here. Some of the hard numbers, suggesting 18% on one hand, 0.1%, at least in the San Francisco example. But again, this data isn't necessarily great in terms of, are they actually tracking diligently like the follow-ups that are happening? So number 3, in terms of the case for legalizing these sites, normalizing drug use reduces stigma, increasing access to supportive services. And that can be both drug treatment services, but also more broadly services. And so here I just want to read some quotes that kind of capture this from people on the ground experiencing that, or who actually have been on the receiving end of this. They say that safe consumption sites didn't just offer an escape from death and the unsanitary and dangerous conditions on the street. They offered escape from the stigma that pounds on the ugliness of their addiction until there is no daylight between who they are and what they do. Shame is rarely a long-term motivator. One of the researchers at the Insight facility in Vancouver that we've talked a lot about says, the place is an official healthcare setting which is not judgmental, which does not stigmatize them for their drug use, and which accepts them as people first and foremost. And so Insight, again, that Vancouver facility, their program coordinator or longtime program coordinator, Darwin Fisher, explains the importance of why destigmatizing drug use is important from his perspective. He says it's about making a space where drug users are allowed to feel like people. We're also mindful that this is a respite from the street, and at times it might be difficult for people to leave the only situation that feels vaguely safe for them in a day. They also, typically when they're going down this road, they admit that these facilities are, a Band-Aid. That's not a long-term solution, but that reducing stigma and just bringing these folks into contact with a trained staff can make a big difference. And so that is part of the goal here from their perspective, is just give them some contact with a trained health professional. However, critics would argue that destigmatizing drug use actually normalizes it, which then increases addiction and increases drug use, and shouldn't be the goal at all. And so here's a quote where it says, injection sites normalize intravenous drug abuse, encourage a horrible addiction, and let down the people who suffer from it. Promoters of these sites offer addicts little but failure, medical safety at the time of injection, but overall mere complicity in a nightmarish cycle of addiction leading to death. Perhaps not when the addicts shoot up under the careful eye of a medical professional, but one of the hundred of other times she shoots up somewhere else. President Trump's former Deputy Attorney General, Rod Rosenstein, makes the same argument. He says, injection sites normalize drug use and facilitate drug addiction by sending a powerful message to teenagers that the government thinks illegal drugs can be used safely. So there you have the case for, number one, that the supervised injection sites reduce overdose deaths. Number two, that they increase access to drug treatment. And number three, that it destigmatizes drug use, increasing access to supportive services. Now let's look at the case against legalizing these centers. So number one, supervised injection sites increase drug usage and worsen addiction. So a little bit of the counter there. Stanford professor that I mentioned earlier, Keith Humphreys, he explains if the goal is to reduce usage, they don't make sense. He says, if you're coming into a place that's supposed to guide you toward the end of seeking treatment and recovery, and there are people using drugs around you, that becomes an incentive to keep going. It's like trying to have an AA meeting in a bar. Data from the unsanctioned site that I mentioned earlier in the United States from 2014 does suggest that this is what is happening, at least at the population level. We don't have individual level data, but in the 5 years that there's data from 2014 to 2019, injection events almost tripled in just those 5 years. And the rate of overdoses per injection event increased by more than 5 times. Now, it could be the case that more people are accessing the facility, thereby increasing the injections, but also it's concerning that the overdoses per injection. So it means that not only were there many more drugs being consumed in the facility, but there was many more drugs per person being consumed. And so that is a sign that, really drug use is going way up. And if we look back at the Vancouver's Insight facility, there, the overdose rate associated with heroin use increased almost 5 times from 2010 to 2017. Now, again, they prevented the deaths, but the overdose rate went way up. And again, this could be, something that was happening more broadly in the population around the site and in Vancouver. And so it doesn't prove that the site and the facility caused this increase, but it is correlated with it. Michael Schellenberger, who was an independent candidate for governor in the 2022 race, and he's also author of a range of books, he argues that, these basically, the way that these sites are structured right now lead to continued drug use. He says, what they're proposing is addiction maintenance. I think that we need to embrace addiction recovery. And he actually interviewed a senior official from a European government who wanted to remain anonymous, but had been studying these sites and working, associated with these sites for many years. And here's a really interesting quote from him. He says, these guys point to Europe as these fabulous utopias of using drugs safely. But when European officials visit, they are horrified. Visit the United States, look at San Francisco. They are horrified by what they see. They say to us, we require the addicts to maintain their obligations as citizens. You let them off the hook. You don't require them to take responsibility for their health and their obligations as a member of a community. That's where you're going wrong. So Schellenberg actually goes on to explain, through this interview that in Europe, police and medical professionals put pressure on those who are addicted to drugs who are breaking the law by using illicit substance to quit. And this official actually only recommends these facilities for a certain very targeted population. He says, I don't disagree with the European model and don't dismiss that overdose prevention sites may have utility for a particular population. And there is no question in my mind that this is a very small subset of the addicted using population whose needs are palliative in nature. Palliative means that it's basically pain reduction as somebody's heading towards the end of their life, that you're not going to necessarily cure them or have them recover, but you're going to reduce the discomfort associated with the pain they're experiencing. San Francisco-based nonprofit Mothers Against Drug Deaths also says safe spaces make addictions worse. And this really comes down to what Schellenberger would argue is a fundamental flaw in how California has been thinking about harm reduction strategies. He says, but many proponents of harm reduction misunderstand the nature of addiction by avoiding any measures requiring abstinence. Many addicts will not stop using voluntarily. By supplying housing and other services with no strings attached, San Francisco misses an opportunity to incentivize addicts to get better. While summary harm reduction measures are positive, they are not enough to stop addiction, as skyrocketing drug deaths show. We need to provide real incentives to drug users to break their addiction, including contingency-based housing predicated on abstinence and the introduction of mandatory treatment as an alternative to incarceration. So that was a mouthful, but basically he's saying you can't just expect people to break free from addiction by offering them free services. You have to incentivize that and give them either mandatory or incentives to quit and to wean themselves off of drug use. Now, there are others who say that actually these sites are not increasing use of drug. And so that long-term study of the Insight Center in Vancouver said they found no signs of the so-called honeypot effect at Insight, meaning it didn't increase or encourage drug use. That meta-analysis of 75 studies from 2014, which again focused primarily on the site in Vancouver and then in Sydney, Australia, they said these sites have largely fulfilled their initial objectives without enhancing drug use or drug trafficking. So there again, we have this discrepancy in the data between what is happening on the ground, and that is one of the challenges of making policy and pushing forward with solutions, is that the data isn't always consistent. Sometimes it paints two opposing pictures there. So let's look at number 2 in the case against legalizing these facilities. Supervised injection sites make the surrounding community drug-infested and crime-ridden. So the idea here is that by authorizing illicit drug use, it's going to attract both drug addicts and then drug dealers, and then all the challenges that are associated with those two populations. Here's a quote from someone, an official actually from Massachusetts, that says, "The consequences should surprise no one. If you're a drug dealer looking for customers, an injection site is where you'll find them. If your neighborhood hosts an injection site, drug addicts will go to your neighborhood." The city of Vancouver dropped the speed limit on the street next to Insight to about 20 miles per hour because addicts might wander into traffic. And others, echo this same argument. The activists like to keep the argument narrowly focused on the addict and overdose deaths. They don't want to look at the impact of these sites on crime rates and their devastation on communities and small businesses. It's folly to think you can attract all those drug users without attracting all the problems of concentrating addicts. You will see drug traffickers moving into the controlled area. Jean Lovell, who, speaking on behalf of the California Narcotic Officers Association, said there is a magnet effect so people come into the area. And specifically around the Insight Center in Vancouver, there was reports that the presence of the site increased public disorder in Vancouver's downtown east side to the point that one official called it a war zone. Within a year of opening, Vancouver police posted 4 officers at the site and an additional 40 in the surrounding neighborhood. Officials in Alberta, Canada, which also went through an experiment with this, they said drug traffickers appear to be openly conducting their business unabated near the site due to a burgeoning client base. Drug users purchase their drugs from these individuals as it reduces the need to transport an illicit substance over a distance, thus reducing the potential of being arrested for possession of an illicit substance. The police are placed in this untenable position of determining how to appropriately engage with clients while the clients engage in illegal activities such as theft, prostitution, break and enter to pay for their drugs. And so we have this weird situation going where we're authorizing something illegal, and then that engenders and produces more illegal behavior. But where did the police intervene? Because we're authorizing some illegal behavior, but then are they supposed to crack down on some of the other behaviors that are associated with it? So it puts them in this position where illegal behavior continues to multiply. Now, others, again, argue this. And so some officials in Alberta say, our observations and data indicate that these facilities collectively have not increased crime or disorder in the surrounding communities. That same study that reviewed 22 studies, they said that there was not an increase in crime or nuisance activities in the surrounding neighborhoods. Okay, so certainly some strong anecdotal claims there, and then some studies that point to different perspectives here. Number 3, in the case against supervised injection sites violate federal law. So there's a federal law known as the Crack House Statute that currently prohibits operating, owning, or renting a location for the purpose of using illegal substances. So the Justice Department under Trump invoked the statute to stop one of these centers from opening in Philadelphia. The Biden administration has not specifically endorsed these sites yet, but city officials from Philadelphia have said that they're much more amenable to it, and they're in talks now that are encouraging and are productive conversations. And we know also, as I mentioned earlier, that New York has opened 2 of these facilities. So this administration is obviously more favorable to it. At the same time, the fact that there's a federal ban on it doesn't necessarily stop California from moving forward, as we've seen in some other areas, like the fact that California is a sanctuary state. So where they basically do not follow federal laws and stipulations around immigration. And so, really we see there's kind of a disregard for that. San Francisco moving forward to prepare the ground for them to be able to open one of these facilities, even though Governor Newsom, vetoed this legislation just months ago, suggests that there isn't necessarily a regard for the federal or even state statutes on this. So there is the case against legalizing these. Number 1, that it increases drug use and worsens addictions. Number 2, that it affects the surrounding area, making it drug-infested and crime-ridden. And then number 3, that it actually violates federal law. What do you think California should do? This bill and this effort to push these sites is certainly not over. There are going to be many more attempts, I can guarantee it, whether through the legislative body at the state level or through the city level. What do you think California should do? Should we move forward in order to prevent some overdose deaths, or should we cut this off and not use anything that could possibly encourage additional drug use? I would love to hear your comments and thoughts and any arguments that we might have missed on either side. Okay, now I'm going to turn to my assessment of these arguments. And this, again, is just my opinion. You are entitled to your own opinion, and I hope you disagree with parts of what I say, because that is where we'll get to a more productive answer in the end. So where I start with this argument is not with a detailed evaluation of any of the particular arguments that we've already covered, but with a broader, more generalized point, which is, should we be encouraging and authorizing illicit drug use? And there, I think that this is... one, it's a challenging question, because whenever you're stacking that up against should we save a human life, that's always a hard argument to have, right? Because who does not want to save a human life? And at the same time, we have to think at the macro level. And what is the macro effect of these? And I personally think that it is more important to avoid fostering the creation of a population of people who are increasingly addicted and influenced by powerful and unregulated substances, so that we should not be normalizing drug use in our culture. That essentially, whether or not drug use is increasing, there's debates around that in terms of the data. But if we have these facilities everywhere, that is going to increase the trend in our country, towards normalizing drug use and these hard drugs that have powerful effects. These drugs, it's not just having too much sugar, which has its own problems, but these drugs have long-lasting physical and mental consequences. The Addiction Center talks about the damage cocaine does to the brain may last the longest. Research from the University of Cambridge found that cocaine may make the brain age unnaturally fast. Addicted users lose twice the brain volume each year compared to their non-using counterparts. And so it's not just as simple as it's not a big deal, they're using drugs. No, this will create both an unproductive generation of people, and also it leads to mental illness, anxiety, depression. And so we are not doing a service to our people by encouraging them to use this as a way to escape reality. Now, people have really hard situations, and that it is really challenging for them to endure that, to cope with that. I totally can empathize with that, but at the same time, enabling them to escape reality and pursue these drugs that are going to have a negative influence on their future is not the way to do that. And some people do require some assistance to propel them onto the path of recovery. And that totally makes sense to me. The European official who says that for palliative care, or even for people who are really in serious addiction and might need this as a way of weaning them off and kind of part of their recovery process, that totally makes sense. But when we think about these facilities, they should be thought of not as for anyone who wants to use, but really for a select population who would really benefit from this without having unintended consequences. And so, is it possible to authorize a safe injection site without creating a larger, more seriously addicted population and further normalizing drug use in California? I think probably not. But even, let's just say for a minute that it is. What do we think of the data here? Again, there's serious challenges. I've mentioned the Stanford professor Humphreys. He reported to NPR saying he doesn't think the available evidence points to supervised injection sites as being harmful, but the research has not strongly demonstrated an overall reduction in overdose deaths over time. The real problem, he says, is there are just not a lot of good studies, period, on supervised injection, so I think we should be pretty cautious. I think that makes sense. We could argue about the specific studies, but I think we should be pretty cautious. And again, even regardless of what happens in the context of the specific facility, if we are fostering a culture that encourages drug use, I think that's a bad idea. And so, like Governor Newsom, I would say pump the brakes on this. California is not ready for this. If we are ever at a point where we are ready for it, one, it should be targeted to specific populations, and we should ensure that we have the full continuum of care that can move people through this and get them into addiction treatment and into recovery. And that we should look at the European model and make sure that we're replicating all parts of it. What we heard from the person Schellenberger interviewed is that we're just cherry picking the pieces that feel right to us, and that is not going to work. We're not going to get the same results there. So that is my assessment. We should not legalize these centers at this time, and to the extent that we should in the future, we should make sure that it is limited to a specific population in a specific context, and that the full continuum of care is set up to facilitate recovery. Thank you for joining this debate at the California Quest. We will see you next time.